Thank you all. As all of you know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors from different parts of the world. The association was formed at the time of COVID when there was no connectivity among doctors, or so we formed such an organization to connect between doctors and homeopathic lovers as well as students. And we are very happy to have 3 sessions in a row. That is from 7 to 8, we have a Hindi session, and 8 to 9, we have our international session in English, and 9 to 10, we have our local language session in Malayalam. We are lucky to have a good guest from Dr. Sahani's family, that is Dr. Amit Singh, Dr. Amit Sahani. He belongs to the family of illustrious family of Dr. Sahani, MK Sahani, and this is very happy. We are very happy to have such a wonderful guest in this evening. And let me introduce him. Dr. Amit Sahani has completed his MD and then PhD in homeopathy, and is the head of the Department of Repertory, RBTS, Government Homeopathic Medical College Hospital, Muzaffarpur, Bihar. So he has completed his PG in repertory from GD Memorial Homeopathic Medical College and Hospital, and later did PG from MK Bhavnagar University. As you all know that he is working in various as well official in different organizations, HMAI, LMHI, like so, and he is an active member in YMCA, and he has done a lot of work for promoting homeopathy among public as well as among doctors and students. And he is a hard-working doctor and having doing a lot of service in Bihar State Health Society and Bihar Voluntary Health Associations. He has written a lot of books, and particularly the book named Conspectus for PG students is appreciated for being an unique book of his generation. And he has presented many research articles for homeopathy, and he has received so many award, that is best teacher award of Cancer Institute of Homeopathy during National Seminar on Cancer and Homeopathy in Darjeeling in 2019. He has been felicitated by Mahendra Singh Memorial Trust on the occasion of the on his presentation of repertory in acute diseases. And so he has so many presentation in nationally, internationally, as well as locally. So today, Doctor will be discussing about a very good subject that is connected to a day-to-day life of every people, particularly those who are having the age of from the very birth to death. You can see autoimmune diseases. Today, the subject is homeopathic approach to autoimmune diseases. So let us welcome our beloved guest, Dr. Amit Sahani, to this. Welcome, sir.
Thank you, Dr. Dhanesh, and thank you, this IFPH forum, for providing me this opportunity. So I have been here previously also, and it feels so good to be with you. So I'll be starting my presentation on this homeopathic approach to autoimmune diseases. So I'll start my presentations first. So I hope my presentation is visible to all of you.
Sir, yes, sir.
Okay, thank you so much, sir. And so as we begin this topic of autoimmune diseases and its homeopathic approach, a question should arise that why this autoimmune diseases, they are on the rise. There is a rising trend of autoimmune disease nowadays. So compromising of the immunity, where each and every human being living on this earth possesses a power to protect itself. We have all been gifted with this power of immunity. We have this ability to fight off the bacteria, viruses, and the toxic substances. So it is quite natural to us. And development of resistance to this infection, and this gives rise somewhere to a place called this autoimmunity. In the modern light, in the modern concept, immunity, it also depends upon, apart from the host, it depends upon the medicines, the virulence of the bacteria or the viruses that are attacking us, and maybe the host resistance also. So it is a combination of all these factors which is making us immune to any probable attacks from the outside. The primary function of the immune system is to protect an individual, the host against the infections of the viral agents. Autoimmunity, it is the failure of the organism to recognize its own constituent part as self, which allows an immune response against its own cells and tissues. Any diseases that result from such aberrant immune response is termed as autoimmune diseases. We have got a lot of autoimmune diseases prevalent, raging nowadays. Now the number has crossed maybe more than 80 as far as what I have checked very recently. So we have got a very a number of diseases. They are coming under the domain of autoimmune nowadays, and the reason is the understanding of the autoimmunity. So autoimmune diseases, they arise from an overactive immune response of the body against substances and tissues normally present in the body. So the body, it will attack its own cell. The immune system mistakes some part of the body as a pathogen and attacks it. So this may be restricted to certain organs. Example may be in thyroiditis, or involve a particular tissue in different places. So this is about the autoimmunity, attacking the body's own cells. So how does it happen? So in this diagram, I'm explaining the different organs which can lead to autoimmunity. So we can see that a good number of diseases, they are being under the domain of autoimmunity. So what is the concept of immunity that has evolved over the years till now? So it started with the concept that this sort of diseases, these autoimmune diseases, they started with the concept of supernatural forces. Then these supernatural forces, where it was considered as a punishment, and now from there on, we moved on to the concept of the imbalance of the four humors, and to the present our miasma theory. So the concept of immunity has evolved over the years, and we have an understanding that it is now the miasma theory which works for the prevailing immunity amongst us. So the autoimmunity origins, it started from the word horror autotoxicus. So which literally means horror of self-toxicity. This was a term which was coined by a German immunologist, Paul Ehrlich, to describe the body's innate aversion to immunological and self-destructions. So there is a misconception that an individual's immune system is totally incapable of recognizing self-antigen, and this is not a new thing. So it is accepted that the autoimmune responses are an integral part of the vertebral immune system. We can also call it as natural autoimmunity, normally prevented from causing diseases by phenomenon of immunological tolerance to self-antigens. So we have some sort of natural autoimmunity amongst us, and which is beneficial. I'll be showing in the coming slides that this natural autoimmunity is to some extent beneficial. It protects us from a number of diseases. Now, while many infectious diseases have been better controlled over the years, there is a steady increase in the prevalence of the autoimmune diseases. Now, this is a thing that we need to ponder. why there has been a decline in the number of the infectious diseases over the years and prevalence of the autoimmune diseases. So as I was doing some search on this thing, I came up to a concept of the hygiene theory. This hygiene theory states that as and on we control the infectious diseases with our hygiene practice, there will be a shift of the autoimmune level. Now, coming to the adaptive immunity. So this is often subdivided into two major types, natural and artificial. And this naturally acquired immunity occurs through contact with disease-causing agents, maybe in a passive manner or maybe in an active manner. And the artificial immunity develops only through deliberate actions. Now, maybe like passive immunizations or active immunizations. Then we have our innate immunity, natural autoimmunity that we have just talked of. Now, there is a difference between the autoimmune diseases, inflammatory conditions that arise in our body. Now, what happens in the autoimmune is that the patient's immune system is activated against the body's own protein. On the other hand, in the inflammatory disease, it is the overreaction of the immune system. So the immune system is producing excess of the antigens, but it is not acting against the body's protein. Whereas in autoimmunity, it is acting against the body's own protein, and that is the basic difference between autoimmunity and the inflammatory diseases that happen to us humans. Then a substantial minority of the population suffers from these diseases, which are often chronic, debilitating, and at the same time life-threatening. So we see that it is these autoimmune diseases, they are the 10 leading cause of death among the women and in the age group up to 65 years. And just as I said, what I have searched, it is we have crossed more than 80 different types of autoimmune diseases. So more prevalent among the females and in the higher age group, and the domain is expanding. The domain is constantly expanding. The list of autoimmune diseases is stretching day by day, and it touches almost all tissues and cells of the human body. No cells of the human body is spared by autoimmune diseases. A protein which developed in the body during the viral or bacterial infection for protection of the tissues and cells turns against all cells and tissues of the body, in turn, is the pathology in autoimmune diseases. Now, once this antibody against the cells, the mitochondria, the nucleus, or maybe even the double-stranded DNA, it will try to destroy its target destination. So a sort of fight starts taking place, and a destruction which is which we know by the name of autoimmunity. A destruction where our body's own protein are acting against our own cells. Now we are talking about autoimmunity. Autoimmunity. So low level of autoimmunity. Now, we have just I've just talked of it. It is beneficial also to some extent. So a high level of autoimmunity is unhealthy, and a low level of autoimmunity may actually be beneficial sometimes. First, low level of autoimmunity might aid in recognition of the neoplastic cells by CD8 and T cells, and thus they help in the reduction of the incidence of the cancer. Secondly, this autoimmunity may have a role in allowing a rapid immune response in early stages of an infection when the availability of the foreign antigen limit the response. That is, when there are few pathogens present, and this helps to develop a natural immunity against those substances. So a low level of autoimmunity is in fact desirable. It is we can say it is a necessary evil. Immunological tolerance. The immunological tolerance is the ability of an individual to ignore self and while reacting to non-self. And this breakage leads to the immune system mounting an effective and specific immune response against self-determinants. The exact genesis of the immunological response is still elusive, but several theories have been proposed since the mid-20th century to explain its how we are tolerating the self and we are not tolerating the non-self. We are reacting, our body is reacting against it and trying to create an environment where it will be difficult for that non-self to survive. It is the level of immunological tolerance that we have to, that is desired, so that the balance of life can be maintained. Now, how is this tolerance normally affected? So we have got three effectors, we can say, and in the form of B cells, T cells, and the thymus also. So the B cells, they are self-reactive, and immature B cells are deleted in the bone marrow. T cells, they are self-reactive, and DP cells are deleted at the CM junctions. Thymus, all are self-reactive and lymphocytes are deleted. Not only strongly self-reactive T cells are deleted, otherwise positive selections would not occur. Not all the self antigens are expressed in the thymus. Thus, some self-reactive T cells escape to the periphery. There are certain factors which affect the tolerance, this immunological tolerance, genetic factors. So it has been researched. It has been a matter of research, and number of genetic factors have been considered to be the exciting factors for all this type of autoimmune diseases. A number of autoimmune diseases, they are linked to the genetic origins, the hereditary factors which are responsible for the development of the autoimmune diseases. Then we have the sex. We have the females, they are more prone to such a type of autoimmune diseases. Then we have the external environmental factors where chemicals, drugs, their doses, the different foods, the chemicals which are basically the chemicals which is responsible for the breaking of this immunological tolerance, and they affect the tolerance, these are some of the major factors which influence the tolerance, leading to the development of the autoimmune diseases. Certain chemicals and drugs can also be associated with the genesis of autoimmune diseases or conditions that simulate autoimmune diseases. The most striking of this is the drug-induced lupus erythematosus, one of the earliest recognized autoimmune diseases. Usually, withdrawal of the offending drug cures the symptoms in the patient. So once we stop the medicine, so maybe the symptoms regresses and the patient may go back to his normal healthy condition. Secondly, the cigarette smoking is now established as a major risk factor for incidence and severity of rheumatoid arthritis. It has been strongly linked to the intensity of the rheumatoid arthritis. This may relate to the abnormal circulation of the protein, since the effect of smoking correlates with the presence of antibodies to the citrullinated peptides. So a mechanism which needs further explanation, how this, to explain the linkage between the cigarette smoking and the RA. So it has to be studied in more detail. So a small diagram to explain the autoimmune disease induction. So the disruption of the cell or the tissue barrier, which results in release of sequestered self-antigen and activation of the non-tolerized cells, that results in a disease. Like here in this figure, it has been shown as sympathetic ophthalmia. So the mechanism of the autoimmune disease induction, how the disease induces upon the human body. An infectious agent causes the disease. Recovery from the disease due to the T cells and the antibody response. A portion of a protein from the infectious agent mimics the self protein. Due to the MHC composition, some T cells specific for the infectious agent protein also cross-reacts with self protein. Now the T cells become pathogenic, responds to the self antigen and recruits other immune cells. And finally, this results in tissue destructions. So these are some examples of organ-specific autoimmune diseases. The Hashimoto's disease, the good pasture syndrome, vitiligo, which are organ-specific. We have got the systemic autoimmunity in the form of SLE, which has a varied range of phenomena, varied range of expressions. The Sjögren syndrome, again having a varied manifestations. So these are some examples of the systemic autoimmunity. Coming to the homeopathic approach, most importantly for the homeopathic, when we consider the autoimmune diseases, it is well under the domain of homeopathy. And to understand the disease first, we have to understand the miasmatic level at which the disease is prevailing. The miasm of each disease shall be assessed by the interpretation of the pathology and symptomatology. The symptomatology shall vary from disease to disease, but pathology is more or less the same for almost all immune diseases. So we have to understand the symptomatology, and from the symptomatology we have to judge the miasmatic dominance of the autoimmune disease. So symptoms of the autoimmune disease, all of them, they start from at the functional level before the structural changes they start. So as soon as the functional changes, they start making some changes in the human body, we say it is the stage of the sora. Even after the structural changes, the functional changes will still persist. And this is responsible for the symptoms. A symptomless autoimmune disease we will rarely see some symptomless autoimmune diseases. Destructive pathology of the autoimmune disease indicates its syphilitic nature. And the functional symptomatology, as I just told, it is the soric expression of the disease. So as long as the disease is at the expressing just functional changes, it is the expression of the sora. But as soon as the destruction, the self-destruction starts, it expresses the syphilitic nature. So as a miasmatic prescriber, we can say that autoimmune disease is a combination of sora and syphilitic miasm, and with prominence of the syphilitic miasm. Psychosis is very less indicated in the autoimmune expressions. Now, through a flow chart, I'll be explaining how this autoimmune diseases, they start from its incipient stage and expresses finally to the stage of the self-destruction. So human beings with a latent genetic susceptibility to autoimmune diseases, so they have got some certain genetic predisposition, we can say. A symptomatic state of a person, and asymptomatic state where a person considers himself apparently healthy. This is the stage of latent sora. This latent sora becomes activated through exciting factors like maybe drugs, chemicals, bacteria, viruses. So these are the exciting factors which are exciting the latent sora, which results in disturbance of the normal physiology of the body, which may usually pass off unnoticed. So these are the primary manifestations. From there, we move on to the exciting causes. They remain persistent and become the maintaining factor, as well as the primary manifestations becomes treated through the faulty treatment. Now this results in suppression of the primary manifestations. Once the primary expressions they are suppressed, this results in internalization of the disease. The disease starts following from the lesser harmful organ to the more harmful organs. The disease will localize to more susceptible system or maybe the systems of the body. Now, because of this genetic trend and maintaining factors, the body will start producing T lymphocytes and the B lymphocytes, which is the beginning of the destruction, self-destruction, because of the genesis of the autoantibodies. Now, this autoantibodies attacks the body's normal cell whose surface contains self-antigens or maybe autoantigens. That is, this is the beginning of the failure to recognize the self, the development of the autoimmunity. The destruction of the tissue through autoantibody, it causes irreversible pathological changes, and this is the development of the complex disease which we have studied in organon of medicine. And this is what we understand, the conceptual understanding of the autoimmune disease with a predominance of the syphilitic miasm. Now, I have just prepared this chart to show where the antibody or the cell-mediated reactions will be associated with what type of disease and what will be the target organs where these reactions will be expressing themselves. So the first one, the red blood cells, they will be associated with diseases like hemolytic anemia, the nuclear constituent of our body, example, the DNA. They will affect the skins and the muscles, resulting in the connective tissue diseases, dermatomyositis, RA, SLE. The thyroid cells and hormones or the TSH receptors, they will affect the thyroid gland and resulting in diseases like primary myxedema, autoimmune thyroiditis, and thyrotoxicosis. The parathyroid cells, they will act on the parathyroid gland, resulting in primary hyperparathyroidism. The parietal cells, the intrinsic factors, the B complex, they will act upon the stomach, resulting in pernicious anemia. The mitochondria, it will affect the liver, resulting in primary biliary cirrhosis. The pancreatic islet cells, they will affect the pancreas, resulting in type 1 diabetes. The adrenal cortical cells, ACTH receptors, they will act on the adrenal glands, resulting in the Addison's disease. The acetylcholine receptors, they will act on the voluntary muscles, resulting in myasthenia gravis. So we can see a varied nature of the diseases and the varied nature of the organs which are associated with the cell-mediated reactions, where the failure to recognize self results in the autoimmunity. And all these diseases which are listed here, they all belong to the domain of the autoimmune diseases. Our homeopathic approach, therapeutically, a number of remedies have been listed under this autoimmune diseases. Prominent of them I have shown on the screen. Then when we understand the autoimmunity at the mental level, there are the repertorial approach, our homeopathic repertory, it is surplus with a number of rubrics. It is showing a number of rubrics where we can express autoimmunity at the mental level. Autoimmunity at the mental level, we have the rubrics antagonism with oneself, where the mind is antagonistic to one's own idea. Then abstraction of the mind, loss of adaptability, antisocial, awareness heightened, capricious. And these are all rubrics which are showing two ways of thoughts, two divergent ways of thoughts, which are self-contradictory in nature, and maybe the mental expressions of the autoimmunity: self-destruction, suicidal disposition, striking himself, tearing, and a lot many other rubrics are there. Where we can see the expression of the autoimmunity, our mind affecting our own against our own will, and the concept of the autoimmunity can be seen at the mental level also. So we need to recognize the autoimmunity at the mental level also. We need to recognize the autoimmunity in the mind of the patient, because as Dr. Hahnemann said, the disease, it originates in the mind and vitiates itself on the physical body. So we have to find this mind-body connection, and understand and correlate the physical body with the mind, so that we can have a deeper understanding of the autoimmune diseases, and a better prescription can be made. So all autoimmune diseases, they need a constitutional treatment. Only homeopathy can offer constitutional treatment in such diseases. Now, the case of psoriasis, which is also an autoimmune disease. Now, this case, aged 42 years, male subject. Now, he complained of blackish patches on the scalp, thighs, and the left side of the abdomen since 3 years. It was itching with the scaly flanks. The skin discoloration was black, burning only on the thigh region, and this was aggravated after getting wet and ameliorated on scratching and rubbing. So the case was diagnosed by a skin specialist, and it was the diagnosis was psoriasis. And we all know, we have an understanding that psoriasis is a disease which is autoimmune by nature. Now let us see what the patient has to tell us. So along with this psoriasis, he was primarily concerned about the outlook. And because of this, I remember he could not concentrate on any activities. He was so much worried about his look and what about the cosmetic importance of this psoriasis. And the associated complaint was that he was having hemorrhoids with eruptions on the rectal region with watery and sticky discharges. So this is the photograph of the patient when he first came for treatment. So you can see the scaly patches, the flakes, the whitish flakes on the scalp, on the abdomen region, and on the joints, on his joints. So the case history of the patient, from the past history, I came to know that he had jaundice some 10 years back, and besides this, nothing else was there. The family history of the patient: the father died of old age, mother had cancer and she died in 2010. He has 4 brothers and 3 sisters. His elder brother was also having psoriasis. Coming to the life situation of the patient, he completed his graduation in a normal way. He was in a private job where his duty was mostly the field duty. Presently, he was serving there since 3 years. No other milestones were noticed. So this was the life situation of the patient. On understanding the mind of the patient, we could see he could not tolerate injustice and would even strike us in anger. He was dissatisfied with life, and most importantly, his job also. And he had not come to terms with the death of his parents, and this used to bother him a lot. He was anxious for his children also, and was sentimental, and had this this, you can say, the habit of anticipation. The physical generals of the patient reflected that the tongue was long and pointed with red tip, thirstless, desire for sweets was there, perspiration odor was offensive, and snoring during sleep. Sleep position was on the back, and dryness of the throat at night, and he preferred winter season. The treatment that he had taken previous to coming to us was from February to March, he had taken allopathic treatment. He changed to Ayurveda, and now he wanted homeopathic treatment. So I did the repertorization for this case, and the rubrics that I selected for this patient was anticipation, discontented, injustice cannot support, sentimental, perspiration odor offensive, skin eruption blackish, skin eruption psoriasis, skin eruption suppressed, skin itching, scratching, must scratch, and general food and drink sweet desire. So altogether, I had taken these rubrics and repertorized using the synthesis repertory. And the repertorial result showed came in favor of arsenic album. Now, I started with the first medicine. It was first prescribed on 11/9/2022. And I started giving arsenicum album in 0/1 potency. And the patient was instructed to report after 1 month. After 1 month of follow-up, he says that there is no change was observed, but we increased the scalp eruption, which was earlier. The medicine was given in 0/2 potency. Again, after almost a period of month, the patient's condition was static with no change in the symptoms. We went up to 0/3 potency. The report was again he reported static, and after which we reviewed our analysis and prescribed Sorinum. And I'll show you the repertory sheet for Sorinum. And thereafter he reported he was much better with the medicine. And I just made some changes in the rubrics and also incorporated this associated complaints. Am I audible? Yeah. Okay. So I made some changes in the rubrics and incorporated the hemorrhoidal symptoms of the patient as well. And there was a change in the medicine, and Sorinum. It came up as the most preferred choice of the medicine on the basis of the repertorial analysis. And the patient he reported for improvement in the cases, improvement in symptoms, and this Sorinum, it was given in the second cup, followed by again in the third cup. And I hope all of you are aware with this method of giving this LM potency. And we observed more relief in the eruptions and itching, and we continued for 3 months without any further change in the medicine. Now you can see after the treatment, after this period of the treatment, the photographs of the patient taken after treatment. On for expressing the scientific domain of this case, this case was assessed according to the modified Naranjo criteria, and the different criteria that were that are under this Naranjo criteria, the monarch scale. The monarch scale, they are there on their screen, and the scoring done as per the monarch assessment of the patient. So the second slide. So this is up to the criteria 6. Then the third slide up to the criteria 9. And finally the 10th criteria. So that within the monarch scale coming with a total score of 10, this clearly showed that the dominance of the treatment, the effective role of the treatment in the treatment of such diseases. Now, having a discussion on this case, the mental and the physical dimension of life is quite similar to arsenicum album, as we can see from the repertorial analysis also, and also the the dominance of the insecurities and the misadjustments with the life, which expresses the demand of arsenicum album. Only to remove this miasmatic background coming from his family and some reflections of the symptoms. Sorinum, through repertorial analysis, we administered it as an intercurrent medicine. Waiting patiently without changing the medicine, we observed psoriasis is getting resolved, and the patients with regular follow-up helped in solving the incurable cases and this autoimmune disease, most importantly, an autoimmune disease like psoriasis. Totalitarian approach is justified with this case. So for this particular case, some very striking characteristic symptoms of the patient could be correlated with the medicinal symptoms of arsenicum album. However, to remove the miasmatic blockage, sorinum was given as an intercurrent medicine. The causal attribution of homeopathic medicine was assessed through the modified Naranjo criteria of homeopathy, monarch. The monarch score was 10, the total score was 10, which suggested a definite causal relationship between the medicine and the outcome. Hence, this report suggests that a correctly chosen homeopathic medicine can be beneficial for treatment of autoimmune disease like psoriasis. So this is all about my presentation. So thank you so much. And if any questions are there, I'll be very happy to answer.
Yes, it's Dr. Amit Sahani. It's really a very good session, as we all know that the autoimmune diseases are really incurable as far as the allopathy school of medicine or the other school of medicine. But when people say that homeopathy is a system which is unscientific one, but you have proven here in this case with all the documentary evidences and the whole scientific yardstick, you have proven once again that homeopathic medicine not only works in a patients in this kind of autoimmune disease, but it also proved that it is a scientific system that works at any condition, at every time. And this is the beauty of homeopathy. And this is what we have to tell the people in and around the world, that we can do wonders with our homeopathic medicines. As you rightly point out, the LN potencies work in those conditions which are very without any aggravation, that not only there is no aggravation, but also we get the yearly cure. That is something great. And anyway, we are very happy with such presentation. Hope that you can come up with some more cases in the future also. I still remember a case of from my memory, an autoimmune disease, the bullous pemphigus bullae. As you all know that it is a big disease, the patient was bedridden, and they were taken to medical college. The patient was admitted in medical college. They diagnosed it as bullous pemphigus. But when he used to, after giving steroid, the patient become unconscious and always getting his sugar shoot up to 700, 600 like that. And then he goes to comatose conditions. And one fine morning, the family member called me and to check him whether he dead or not. But frankly, because of the interference of homeopathic medicine, we were able to cure the patient, not only from the bed he was saved from the disease, but he was able to live up to some 7 to 8 years more. And when I when I took the case in detail, what I found that the patient was taking 33 tablets a day. 33 tablets a day. He was having a stroke in the early part of his life, and from there he used to take a lot of medicine, and that may be the reason why, as you pointed out in this case, the reason you also told that some drugs may make these autoimmune disease, and it is it is exactly that was my observation in those cases. and I just stopped the medicine to 6 first, and then I just asked the patient to remove all the medicine, and then we were able to cure the patient, and that is the beauty. Anyway, congratulations, Dr. Amit Sahani. Yes, you proved that you are also one of the gem from the Sahani family. Congrats, doctor.
Thank you, sir.
And let us invite Dr. Ram Paresa. And if anyone want to have a chat with Dr. Amit Sahani, it's an opportunity for all of you. Please raise your hand so that we will allow you to speak at this session. Dr. Ram Paresa, so please unmute yourself, sir.
Thank you, Dr. Amit ji. Very nice presentation. Excellent session. Beautiful describe autoimmune disease. Cause and effect. Very nice.
Thank you, sir. Thank you.
Separation of anger, grief, mental, thought, etc. Cause of autoimmune disease. Thank you. Very nice separation.
Thank you, sir.
Arsenic and Sornam is a beautiful remedy. Presentation case. Presentation case. Thank you. Thank you.
Thank you so much, sir.
वाह,
Thank you.
बहुत अच्छा, बहुत अच्छा.
Thank you, sir. Thank you.
Before going to Sridhar Akru sir, I invite Sahani sir to say something. Please unmute, sir.
Dr. Kuruk should say something.
Yes, sir. Okay, sir. I invite Kuruk sir. Please unmute, sir. Sir, you are muted. Please unmute.
Is it audible?
Yes, sir.
Amit Sagani Saab, your presentation was excellent. It is for the other system, it is very difficult to cure. But I also cured a few cases. First I was having difficulties. Then I realized it is my inability. One about 52 years lady, because she was not, she was unmarried because of this disease. And then she was treated and she stopped that. She was a beauty parlor person, beautician. And then she was having so many other complaints. Then totality of symptom I repertorized. I got Parsatla, the highest mark. And then I compared with the Latin America, and I gave only within 1 or 2 months, she is completely cured. And she joined for her job, and now she is well. Like that of so many other cases, I am telling only one cases. I give 0/3 potency. It is what you said. It is that the LM potency is far better and very competent in curing such cases. So-called injury cases, we can cure with our homeopathic medicine. Thank you very much. Come again.
Thank you,
And
sir.
with
Thank you, sir.
another subject, thank you very much. I am so happy to know your presentation was extremely good, very good, excellent.
Thank you, sir. Thank you so much.
Now I invite Dr. Marian Salsova from Bolivia to say a few.
Thank you, Dr. Danesh. Good morning, good evening, good night to everyone. Sorry, today my camera is not going well. And I really enjoy the presentation, Dr. Amit. Thank you very much. I just read your biodata and it's amazing. Thanks for all your work for homeopathy. And thanks for represent homeopathy internationally in a very good way. So the topic is amazing because it's challenging for all of us. Autoimmune disease is a very important nowadays, more after the vaccines. So thank you very much. Come again, and we will be waiting for you for learn for your knowledge and experience. Thank you very much. Thanks, Dr. Danesh.
Thank you.
And now I invite Dr. Mahesh Prasad Singh, sir. Please unmute yourself and you can ask you can have a chat with Dr. Amit. Dr. Mahesh Prasad Singh, can you unmute? Do you want to say anything? Dr. Ahmed Hassan from Saudi Arabia. There's some problem with the Dr. Mahesh processing that. Sir, if you can unmute, you can speak now. So now I invite Sahani sir to say a few words.
Good presentations.
Yes, sir.
I feel now the autoimmune disease has become an scenario for the entire world, and especially in our country, this is increasing day by day. And one of the things that I feel, this autoimmune disease is going to explore and establish the homeopathy as a system of medicine. Why? Only because the autoimmune disease has a good answer only from the homeopathy. Because until and unless the medical profession will adopt the totality principles of homeopathy, that is taking the mind and body and spirit together, the disease is not going to. So this autoimmune disease is giving a message for all the medical professions to see the man as a whole, not the part, not the disease, man as a whole. That is the Hahnemannian concept. So it is just a acceptance that it will promote and provoke the people to. And now I feel that the allopathic professors, they have also accepted this, are gradually accepting that this psoriasis or so many other disease, they are psychosomatic. That means that there is a great involvement of the mind and the body together. So this is just an acceptance of the homeopathy. So whatever way may be, we accept either in the name of the homeopathy or in the name of the principle. That is makes the similar. And ultimately, I feel that the medicines needs to be unified together, because before Hahnemann, there was the single system of the medicines where it included everything. In our Indian system of medicines also, there was the only one system. It is only because we are separating, we are becoming very much leftist or rightist. This other following. So getting, and it is also the government of India is also planning to have an integrated system of the medicines. So definitely for the homeopathic professions, it is a good opportunity to demonstrate and to explore to the whole society of the doctors to know that the strength of the homeopathy, where homeopathy is working, and why the homeopathy is becoming successful in the incurable disease, so-called incurable diseases. And similarly, now they have decided to group in the classification of the disease in a group manner, like PCOD. What is PCOD? It is a group of the disease that is included there. So this type of the things, the terminology are coming up, and this is also indicative of the acceptance of the man as a whole. So you accept it this way or other way. This is important, and it is not the matter that you accept the homeopathy or the allopathy. It is the matter. Unity in the medicines has to come up. This is the Hahnemannian approach was also like what Hahnemann never said allopathic had. He said there need, and it is well documented in the medicine teaching. In grave emergency, we have to opt for the system of medicines also. So definitely, I feel that we as a homeopath must express philosophy and stick to our philosophy. But if you establish, you will not never. Don't look what the others say. You just look inside yourself so that you can understand the philosophy of the homeopathy and you can emerge as the best is a good presentation, but he has written the case, also tried to justify with the modern technology of the measurements of the disease. This is becoming very much important. So I thanks that type of the lectures are invited and thank you very much.
Thank you, sir. Now I invite Dr. Neha Kakar to say vote of thanks to Dr. Amit Sahani.
Yeah, good evening, everyone. It was a very nice session with Dr. Amit Sahani today. He briefed us very well about the different types of autoimmune diseases, their etiology, and how the course of autoimmune diseases takes place inside the body, and what are the causative factors in the modern world today we are facing in development of autoimmune diseases. And he also presented a very good case of autoimmune diseases today, and threw a light on how repertorization in homeopathy helps us to find the correct remedy, also taking in account of the miasmatic background of the diseases. It was a very informative and nice session, and we hope and in future also that we will get such beautiful and informative insights again with Dr. Amit, also from the Sahani family. Very nice and educative session. Thank you very much.
Tomorrow we will have a session from Dr. Venugopal S. Reddyar, MD, MRCP, physician and behavior scientist from USA. And the subject will be psychology of aggression. Thank you, Dr. Neha and Dr. Amit Sahani for this session. Dr. Amit Sahani has done a wonderful job in making this session beautiful, because he has beautiful slide presentation. Everything was covered, and later we have a good discussion. Thank you all for joining this session. With that, we come to the end of the day 1260.